Hi, it's Karen Damshin with Damshin Financial Planning, and today we're going to talk about health insurance and Medicare, and I'm going to give you 10 terms that you should know anytime you're dealing with your health insurance, whether it's Medicare, whether it's individual health insurance, whether it's your employer plan. We want to make sure you know what these 10 terms mean. Number one, premium. A premium is the amount that you pay every month for the privilege of having insurance of some sort. So my Medicare folks, you pay a premium to Original Medicare. You also pay a premium potentially to a Medicare plan. Individual health insurance folks, that amount you pay every month to your health insurance company, that is called your premium. Number two is deductible. A deductible is an amount that you may owe for some type of covered health service before your health insurance plan will start picking up some costs. So, for example, if you have a $1,000 deductible and you need to go have surgery, chances are you're going to have to meet that deductible before your health insurance plan starts paying some of that cost share. Number three is a co-payment or copay. A copay is an amount that you pay for a covered service, like going to see a doctor. Maybe you have a $50 copay, or maybe you pay $100 to go see a specialist. The amount can vary, and it can vary based on the type of covered health service. Generally, we would see copays to specialists that may be higher than a copay to a primary care provider. However, with copays, it is common with health insurance that there may be some services, like going to see a primary care provider, that may be covered just under a copay, and you may not have to meet that deductible first. Term number four is co-insurance. That is the portion of a medical cost that you pay for covered expenses after your deductible has been met. So again, if you need to go have surgery, you're in the hospital, you meet your deductible, say it's $1,000, then you may have a co-insurance of say 20% or 40% of medical expenses. And so you pay that co-insurance after you've met the deductible, then your health insurance company pays the rest. And you continue to make these payments all the way up to your max out of pocket. We'll talk about that at the very end. Term number five is a prior authorization. You may see a prior authorization referred to as a pre-authorization or pre-certification. Those are all common terms we see, but this is a decision that your health insurance company has to make about some healthcare services, maybe things like medical equipment. There can be prescription drugs or treatment plans where you may have to get the approval from the health insurance company in advance, or that service, medication, etc., may not be covered. Having a prior authorization is still not a guarantee that your insurance company will pay for it. And these prior authorizations can be required except for when it's an emergency. So if your insurance company requires a prior authorization, make sure that your medical provider's office requests it before you have the procedure done and verifies that it's a covered benefit. Term number six, I want to talk about networks. We have in-network and we have out-of-network. So when you are in-network, that means that you are working with a provider that has a contract with your health insurance company to provide certain services for you. And when you are in-network, once you've met your deductible, then you may have that co-insurance that may go to those providers until you've met the max out of pocket. Even if you have a PPO plan, it is typically cheaper for you to stay in network than go out of network. If you have an HMO plan, you must stay in network. you don't have the option of going out of network. If you go out of network, then that is a service provider that doesn't have a contractual obligation to meet the same costs as an in-network provider. They may still agree to see you out of network, but they are not bound to any sort of contract as far as costs go. Okay, so if you go out of network, that provider can agree to see you, can take potentially what your insurance company maybe was willing to offer as payment for that service, but then they can balance bill you. Balance billing is our next term. This is when a doctor's office can bill you the difference between what they charge for a procedure and what the insurance company says is the allowed amount. So for example, you go to see an out-of-network doctor, they charge $100 for the visit, but the allowed amount from the insurance company was only $70. If the doctor is in network, they can't bill you for the remaining $30. But if they are out of network, they can require you to pay the difference. Our next term is the maximum out of pocket. This is the most you will pay out of your pocket during your health insurance's plan period. Usually it's a year, calendar year, before your health insurance plan begins to pay 100% of the allowed amount. This max out of pocket does not include the balance billing we just discussed, does not include any care or services your plan doesn't cover, and does not include that monthly premium you pay every month. Item number 9 I want to talk about is an appeal. An appeal is something you can do. You file it with your insurance company if they have denied a service or a treatment that you believe should be covered. You can file something called an appeal. Typically, you need your doctor's help with this. It would say, yes, this is why you need this specific service, this specific medication, and see if you can get the insurance company to pay for it that way. Number 10 on our list is a grievance. A grievance is different than an appeal. And a grievance is typically filed when you are upset about the way something was handled. If you were upset that the doctor you wanted to see wouldn't see you even though they were in network on your insurance, or a way that you may have been treated at a facility or something like that, that is more of a grievance. That is different than an appeal, where you're trying to appeal to the insurance company to pay for a service, treatment, medication. So those are 10 top terms that I believe everybody should know about health insurance in general. I'd love to hear your feedback and let me know if I missed anything. I'll see you again next week.